In order to reduce the occurrence rate of shaken baby syndrome or abusive head trauma, parents and caregivers need to be educated, which could save children's lives. Shaken baby syndrome is a largely preventable form of child abuse in which a child is shaken violently and repeatedly. It can lead to injuries including, but not limited to, blindness, deafness, seizures, paralysis, and death. A child is often shaken out of frustration and anger, and the caregiver is often not intending to harm the child, but nevertheless, severe injuries can occur. Of those who suffer from shaken baby syndrome, 25% die from their injuries, and of those who survive, 80% will experience permanent, lifelong damage. Young or single parents statistically have a higher rate of causing shaken baby syndrome, and therefore it is extremely important to give them the correct education about how to keep their child safe. My PICO question states, for single mothers under the age of 21, an education session should be provided before discharge so that, like educated mothers, they will have an understanding of shaken baby syndrome, which will decrease the occurrence rate. When conducting my research, I used CINAHL, PubMed, and Google Scholar to find my articles using keywords such as shaken baby syndrome, abusive head trauma, young parents, and child abuse. My proposed intervention is providing mothers with education materials as well as a hotline number they are able to call if they become frustrated or overwhelmed. Pamphlets and websites can also be recommended in order to give them access to more information. In order to implement this, mothers will be taught by the nurse in the healthcare facility about preventing shaken baby syndrome through educational videos, pamphlets, and simulation using a fake baby if possible. The learning will also be personalized to the individual and their situation. For example, young or single parents will be educated about why they are considered higher risk and how to prevent this trauma from occurring. They will be taught and encouraged to walk away from a crying baby in order to cool off. In order to evaluate the effectiveness of the teaching, the parent or caregiver will be asked to take a survey before and after their education session about shaken baby syndrome. This survey will evaluate their pre-education knowledge, and then after the session, their post-education level of knowledge. It will evaluate what they know about how shaken baby syndrome is caused and the effects it can have on a child. If their knowledge increases, then the education session was effective. In conclusion, shaken baby syndrome is a serious issue that needs to be focused on and prevented. It is often handled after the fact, but we must change that to focus on prevention. Educational materials along with a simulation baby experience provided to the parents or caregiver, as well as evaluation of their learning, can make a huge difference in a child's life and prevent them from experiencing a traumatic brain injury.